So today we are going to see the medicines, Bacilinum. Now, before going into the subject, it is necessary that you should understand that Bacilinum is a medicine which comes under the nosodes group. I think you all may be aware about the nosodes that they are produced, they are prepared from the diseased parts of the living organism. Any diseased part of the living organism or the product of the disease, or disease of the disease. Now, why we think about the nosodes, why the nosodes was introduced in this homeopathic understanding. This is important before you issue. But nosodes are the substances which represents the deep pathology, or you can say the ultimate pathology. Ultimate pathology means the pathology has been which has come to an end as an end product, and it is now has become a very deep active system. Now, when you think about the Hahnemann's idea about the chronic disease, the chronic disease says that the chronic disease are cured only when we have included the miasmatic. So when this nosodes group are basically deep, the symptoms are deep in nature or very at the basis, at the base of the or inner side, and it represents the deep pathology, generalized pathology, and which is the outcome of that. So because of this, nosodes are being utilized, and it was initially introduced by Dr. Herring based on the chronic ideas that was prepared by that was postulated by Dr. Hahnemann in his chronic disease. Now, with these introductions about the nosodes, I think you may be thinking now that this Bacilinum medicines is also a deep acting or some type of the substance which has been prepared as an extract from the diseased parts of the person. So let us see this diseased parts of this medicines through these slides. Now, now we are going to understand this. I think you may be thinking that Bacilinum, as I told you that it is no source. So we are going to see how Bacilinum is no source, how the Bacilinum are prepared, and what are the characteristics feature of it, and then what are the things that has been told by about the Bacilinum, and it has constituted one of the basic things for the homeopathic principles. So, Bacilinum is a no source, as I told you, which was first described by Dr. Burney, and he prepared it from the tubercular sputum. The person who was suffering from the TB, and the sputum was taken by Dr. Heath. This preparation has been experimented separately. I think the whole advisable symptoms apart from this nosodes are related to the typhus. That means the tuberculosis. Now, Bacilinum has been considered that there are four types of the nosodes are there. Might have heard about it in the study in the past pharmacy. It belongs to the basic groups, and they are prepared from the lysate of the microorganism. Lysate means the things the bacteria, the sputum was taken, it was crushed of micro capable of producing and this is done in order to extract the endotoxin, the toxin that is related, and then pure microorganisms are collected from the clinical materials, that is the sputum, suffering from this disease, and then it is aerated. It is that is called the bacterolysis, taking the bacteria of the hypertension with the inner centrifuge actions by 10,000 RMP for 30 minutes. So this is the process, and I think you may be aware that this process is applicable to all the nodes that is applicable, that belongs to that basic nodes. Now, because I told you that this bird, Bacilinum, was introduced by Dr. Burnett himself. So just you can imagine what he says about it, and what Dr. Henry Clark has spoken about it. It is an intercurrent course of Bacilinum will make a wonderful change in the patients who have a personal or family history of the chest affection. That the initial idea about the use of the Bacilinum is available in the practical dictionary of the practical mathematics by Dr. by Dr. Uh, Clark. And this is very important that why, and Burnett is also known as the person who was the founder for or propagation for the nosodes. Uh, Bacilinum has been used in infrequent dosage. That means at the interval of 1 week or more in the 30th potency and upward on dietetic indications in the affection. Dietetic infections is the constitutions, the diathesis that has been prepared, that you can see the constitution, that the tubercular or the tubercular type of the tubercular diathesis. In the proving, it was recorded that there was a severe headache by the deep by the motions with constant symptoms, also with a slight cough and easy expectoration of the phlegm. The sputa that comes out very easily. There are there are certain type of the sputa which comes difficulty, but the slightest trying to cough will expel the sputa. The symptoms schema are taken from the Burnett, from his record, from the record. This is spoken by Dr. Clark, that he has taken all the records of the symptoms that was recorded by the Burnett and Clark himself. The cure of consumptions and its own virus. And this is very miraculous that Dr. Bukov, who spoke that cure of consumptions with the cure of tuberculosis by the TB, tubercular bacillus, is one of the wonderful things that you can see in homeopathy. Now coming to the characteristic feature uh, uh, of this bacillus. The first things are basically because it is related to the chest, so our attention goes to the respiratory complaints. That means the patient will be suffering from chronic cough, persistent cough that is dry or loose, especially with expectorations of greenish or yellowish sputum. The sputa that comes out are usually greenish or yellowish in nature. When you see the type of the expectorations, you can identify whether that it is of the chronic nature or of the acute nature. When the color of the sputa gets changed, like from the mucus or watery, it may not be the deep or, but when it is there in the chronic state, it becomes slightly yellowish or greenish or in the darker form of the, when it is state for. So chronic cough, you will see where there are the greenish or yellowish sputa, this is indicated. In the cases of tuberculosis, which is used as an intercurrent remedy with the complement of other treatments. Intercurrent medicines means the medicines which is used in between the main medicines which you have selected for the. I'll go to it about. I'll talk about it later on. Now, in the asthma also, where there is a history of tuberculosis or a family history of the tuberculosis. So this is the basic symptoms that everything that you see, the chronicity, tubercular is the lysine of the lungs, and the asthma, the breathing problems. These are the basic things that you can see with the respiratory complex. Next comes the general tubercular diagnosis. Now, what is the meaning of tubercular diagnosis? Tubercular diagnosis means the person who are susceptible to the cold, they catch cold very easily with the respiratory infections, and this is especially in children for it with the weak constitution, the students or the children who are very weak and where for him the things remain. There is another rubrics that you can see in the repertory, that is cold taking a tendency to, and a cold taking a tendency to. So this is called susceptible. Susceptibility means the tendency has developed to take the catch the cold. So this is the frequent cold and cough respirations. Then emaciation. The children are eating well. They are in spite of the good appetite, everything is there, but that they remain emaciated, lean and thin. Their growth is retarded. Then this type of the persons, all tubercular persons, they have the night sweats. That means perspiration in the night, profuse perspiration in the night, and especially in the patients with the tubercular tendency or tuberculosis in the background. Then there is skin conditions. No, see, the directly after the lungs conditions, you get lungs conditions, there are a direct relationship with the skin, because whatever happens, patients are used to suppress the lungs conditions or the glandular internal things, and they get appeared on the skin. Now, the type of the skins are very deep, are very chronic, like uh, like the seasonal scabies or simple eruptions, it may not be indicated, but the eczema and the psoriasis or the persistent skin eruptions, they are called the obstinate type of the eczema, obstinate type of the disease. They are not easily going to remove. Eczema are not cured by any intervention of the allopathic medicine. Psoriasis is not going to be cured by any interventions of the and when especially in those patients where there is a tubercular history. Tubercular history means history of either in the personal or in the family or in the surroundings. I say the surrounding also because many patients who are living with the tubercular surrounding, they also get to infected by that. Then there are the glandular effects. Now this is the third layer. The first layer was the lungs. Second layer was the glandular affections. Now this is the fourth layer, that is large glands. Tonsils are glands, and all these lymphatic glands, cervical glands. Many children come and they don't have any problem, but only the glands are increased. And sometimes there is a tendency to separate, and it is a deep pathological changes in the gland. That means suppurative stage means deep pathological changes in the glands. Now, now all these effects are affecting the mental and emotional states, like anxiety and fearfulness. This is the tendency there with a deep impending doom. This means depressions are there, anxiety, fear, and what will happen next. This is the important thing. They are more anxious about the future. Then irritability, increased irritability and restlessness. Uh, and then melancholy. They are tendency towards the depressions, always mind is not stable. They are always thinking in the negatively with the and but whenever there is a tubercular disease, their history it becomes more prominent. I'm talking that whenever tubercular symptoms are there, it becomes more important. That means there is a direct connectivity. But even when there is no tubercular, you cannot find out because many patients they do not remember whether the tubercular was there in the family or not. But these symptoms also indicates that there may be the tubercular that indicates history in the family. Then comes to now that this is the joint effect. This is deeper action, acting on the deeper plane. When it touches the joints or the bone, it becomes very chronic. So chronic bone infection, osteomyelitis, that means the bleeding in bone infections, and then it is discharging. It is always pus is coming out and it is not healing. So bony infections, osteomyelitis, and you can see the patients who got injured and broken his bones, and even after the repairing, they do not get healed easily, and they start suppurating discharges coming out constantly. Then that is the condition which represents the osteomyelitis, and this is a chronic bone infection. Now the joints pain, all type of the arthritis, rheumatic arthritis, and which is often, whenever you think about the arthritis, you can correlate them with the cold or the damp weather. Now, headache is another important because it is the outcome on the head, chronic headache, persistent, recurring headaches, particularly in those with the tubercular family history, pain with the neural involvement, migraine, and autoimmune nature. Autoimmune nature means now it is not going to be healed, and the patient himself are become immune towards the healing process. And other characteristic features are general, are the weakness, easily getting tired, fatigue, weariness, disappropriate to the physical activity. Even if they are not working, they feel tired. Whenever they are overworked, they feel better. Overworked, they feel better. Whenever do not work, disappropriate physical activity means what type of the physical activity? Just opposite type of weakness you will see. If it is hyperactive, the patient will feel better. If it is dull and loathing, the patient will feel weak. Then fever, constant feeling of the low-grade fever, that is the feverish sensation. The patient may often complain with you that the fever is coming, fever is there, and when they try to see the with the temperature thermometers, it will not come. So this is low grade fever, and in the mind chapter of the repertory, you can find excitement feverish. This is the rubrics. This is very much associated with it. Then digestive issue, chronic digestive, gas, constipations, they are associated. This is now, what is the type of the constitution? Coming to the type of the constitution, they are the flat, narrow, hollow chest. Flat, narrow, and hollow. Hollow means it deep, chest, shoulder thrown forward, like this. Shoulder thrown forward, and undernourished appearance in the skin color, going from the deep yellow to the brown, grayish brown. A psychological makeup of the initial stage of Bacilinum cases is characterized by combinations of overflow of energy with voracious appetite and weight loss. They eat well, too much eating, too much eating. They are very much bulimia type of the patient. Habit of eating more and more, but whatever the weight is not in proportionate with the development amount of the eat. The energy cannot easily be disciplined, and the patient does not know how. So over hyper energy, hyper children are very hyper, and they eat very well, and they are but their energy are not balanced. So he may be very active sexually, or he may be very actually active in any other, like suppose he is deeply interested in study, he will become a very voracious reader, voracious sexual behavior, or voracious type, active type of that. Whichever way he goes, so they are the constitutional. This is the constitutional energy pattern of the. With this energy, they feel that the energy is not going to live for a long time. So they want to exhaust themselves and also try to force themselves to keep a balance of their experience. Tuberculosis, fast progressing tuberculosis and degenerative state. The process degenerative. Now the anti-tubercular medicines are prescribed by the HAT medicines. Patient takes for 8 months, 9 months, but still the things goes on degenerating. This PS energy produces an internal sensation of something being burned up, rough kind of a thing. The inner state of the patient can be described wild animal. Now, this wild animal is very important word because wild animals, they are very erratic type of the thing. They can behave abnormally, and they are. It is difficult to control the wild animals. So, this type of the constitution, which you can see the patient children to be very lean and thin, but they become wild. They can become so violent. They can do anything, and they have become very daring with the fast movement. uh, overabundance, I mean, as if the energy is too much. And with this, there are the patients are irritable, snappy, and sulky. The appetite is lost and is replaced by constant weakness. The patient eventually becomes melancholy, and as the weakness grows, the patient will become melancholy, morose, with unsteady and heavy mental faculties and unable to think. Now, generally, Bacilinum individuals present a great sensitive to many external influence. So, highly sensitive to the external. They easily catch cold. They easily become victim of the sun. They easily become any type of the external influence. If they go out eating too much, they become. They are prone to become allergic. And it is manifested in the respiratory system. Bacilinum is indicated in hay fever case that for hay fever overnight, immediately they get a catch cold with a mucopurulent discharge. Uh, when tuberculinum fails, and in that case, the stocks we have taken, and this medicines become very important, and sleep is very heavy and profound. So these are the generalities. Now, clearance of obstacle. Now, the Bacilinum has been regarded, and also not only Bacilinum, but all nosodes are regarded as clearance of removing the obstacles. Bacilinum is primarily indicated to a patient with a tubercular diathesis presenting with respiratory glandular bone, as I told you, along with the characteristics mental and emotional symptoms. It is particularly used in chronic stubborn case where there is history of tuberculosis or a strong family of history of tuberculosis. As with the homeopathic remedy, it is important to match the totality of the symptoms to the remedy picture for optimum results. Now, it has been observed by Dr. Clark that it is useful for the Addison disease, alopecia, conjunctiveness, defective growth, hydrocephalus, idiocy, insanity, affections of the joint, psoriasis, ringworm, scrofulous gland, teeth defective. These are some of the indications that which has where it has worked well. But I don't tell you that you just get limited to this. There may be any other situations also, maybe any other clinical conditions where you can think about this medicine. Now, dosage, usually it is 30 to highest potency, and it is not only this, any of the nosodes, they should not be prescribed below the 30 potency, and they should be always try to be prescribed in higher dosage. Dr. William Borick in his Medica, he writes that dose is important, should not be given below the 30th and not repeated frequently. Now, one dose a week is sufficient. It is a rapid action and good result to be seen soon, otherwise there is no need for the repetition. The relationship, this medicine is very much related to the calcarea, phosphorus, goes with the remedy very well, and that means it is complementary to each other, lachesis and calicar. Now, there are some important topics in your repertory. It is related to the Bacilinum, anxiety about the business, anxiety about the money matters, Then biting nails or anything, try to keep on biting. Desire for uh, company, uh, but conflict desire is changing constantly. The desire for the doctor, they want to meet doctor. They are hypochondriac type of the patients. Despair recovery, they feel that they are not going to be cured. Mental development arrested, and fear of the black dogs. Then another rubrics are fear of the disease, cancer, impulse to move, sudden impulse that the child may run. Then obstinate children, spender money, they are very extravagant in money. They are not careless in spending the money. Striking his head against the wall, travel desire, well says when the person is very sick, but he say, no, I am well. This is very, very similar to the Ardika. Then another rubric, GIP, abdominal pain in large glands in the groins, the side, takes mesenterica, that means this is the tuberculosis of the intestine, indurated and swollen glands, spleen region bulging out, spleen region coming out, the inguinal glands indurated and visible, chronic diarrhea. Then another back of neck enlarged and tender, sensation of damp clothes on his spines, and something has damp cloth in the foot behind the spines. Very sharp pain in the left scapula, worse lying down in bed at night, better by what. But whenever you use these rubrics, try to find out what are the background, because unless it is considered, all these rubrics need to be considered in the life situations of the patient. Eye, otitis with the sore throats, eczema of the eyelids, face indolent, pimples on left cheek breaking out from time to time with persistent many weeks, and appetite is very poor. Respiratory weak lungs, humid asthma, cold and with sore throats, hacking cough, hard cough, setting patients more during sleep but did not wake up. Cough, the violent cough is there, hacking means the body starts moving, hard cough, it shakes the patient, and mucopollulant expectorant of bronchitis, congestion of the lung, tuberculosis, easy expectorations, viscid in nature, and easily detached, thick phlegm from the air passage. Steam, ringworm, pityriasis, eczema, there you will find sleep, absolute sleeplessness, talks in sleep, drowsy during day, restless at night, many dreams. Teeth are pyorrhea are there, fever, feeling of the tartar of the teeth, then aching in teeth, especially lower incisor, very sensitive to air, grinding teeth during the sleep, and imperfectly developed teeth. Fever with emaciation, abdominal pain, and discomfort, restless at night, gland of both groins enlarged and indurated, dries out in sleep, strawberry. The strawberry type of the marks will be there during the fever. Then nightly sweats, uh, worse at the midnight and early morning, and worse from the cold. Then now coming to the comparison between the Bacilinum, because both the medicines are prepared from the tubercular bacillus. Many of the senior physicians have to, I have that this is NM Chaudhary also. Tendency to take cold. And they are all similar. These are the reference that you can see on this slides. Tendency. Now just try to see the difference between the Bacilinum and tuberculosis. Bacilinum is a chilly patient, whereas the tuberculinum is a hot patient. Now it is very easy to differentiate with this understanding. More acute in nature. Bacilinum is more acute in nature, and tuberculinum is more chronic in nature. What is the difference between Bacilinum and tuberculinum? Bacilinum are the pure bacteria, and tuberculinum the entire sputum. So this is the, you can see, say that tuberculinum is a crude thing and it is a refined thing, Bacilinum. So it is okay. So chronic nature. Then Talcidate, rather dryness is more marked, and exudate means it is wet type, it is dry type. Patient sweats negligible, there is no sweats, but tubercular patients are very sweaty. Legs expectorations and the expectorations are more. Then good looking backward in nature. The patient is blonde, they are very good looking, and for tuberculinum and phosphorus, they are the pulsatilla, they're intelligent, sharp, aggressive, irritable, grateful, malicious, selfish. Then frightened, particularly by dogs. Um, uh, and a case of insanity with patrasis yielded rapidly with the remedy. This is called by the class. Prefer any artistic activity, classical music, melodious music, painting, drama, etc. Cosmopolitan, they want to travel. This is the, and just you can imagine how different they become. Now there are some important message for you. Burnett says, although the use of chronic disease, uh, what it does not do soon and promptly, it does not do at all. In acute, I mean begin at once. Then Burnett often use the term organopathy, not organopathic and organopathic indications for Bacilinum while taking its application for that, because he was basically concentrated on the tuberculosis, so he called it this medicines to be the organ related medicines, that means the lungs related medicines. The Burnett advocates free infrequent dose of the Bacilinum in long standing cases. Burnett says that IC virus only acts within its own sphere. In his conclusion to the cure of consumptions, Burnett declares use higher and higher potency for cases of itis and tuberculosis. In second edition, he clarified that or late or a complicated case might yield to medicines other than Bacilinum, but early or uncomplicated case will respond completely. If there are vaccinosis, carcinosis, or syphilitic parts, give respective course because Bacilinum touch a bacillary part of the case only. Then Ellen also speaks about in his Homeo recorded in July 28. I repeat, tuberculinum, as I repeat, eponites, arsenic, and sulfur. Then he says, in deep-seated, long-standing case, constitutional effect, sodic magma, tubercular magma, 40 to 50 years, this is it is able to control. Then Wheeler, another cystic bacillum, a good choice in old chronic bronchitis case, as it no source from mixed infections, tuberculosis lung. He added sweating on the slightest exertion and straight stains with the linen yellow, staining the cloth. Swan said that Swan was another person who proved many of the homeopathic medicines, many of them were sourced. Yes. Here we have proving ready-made by nature for us in human being when you have the same sickness administered at the process time. Dr. Tyler suggests Bacilinum for acute rheumatism. Huh? Then Dr. Emil Tyler used Bacilinum as almost a specific for ulceration cornea. Then Clark quotes Bacilinum to be immensely useful in inflammatory conditions of the eye. As per Dr. Neville Vernier, so Brenoville, Julian, you can see this writing on the treatise of dynamic immunotherapy. There is always a necessity of practicing at first the technique of cleaning or draining the homeopathic therapy. Now, as I told you, nosodes are usually used as cleaning materials, clinic medicines. So, the homeopathic therapist should use this Bacilinum as the clinic and the lower dilution. Now, he is suggesting about you in the lower dilution for the general public. Dr. Kent in his lecture has advocated to procure, experiment and use Burnett's original Bacilinum from more pronounced results in tuberculosis of lungs, brain, and also used in the suitable rheumatoid arthritis case. Dr. understood Bacilinum acts well in the humid climates. Then clinical John F. Gray. clinical conjuncture were carefully constructed. The whole of the retrospect of medical literature are guide for the successful use of the Vecchia Medica. So these are the important messages that you see for these medicines, and I think this medicine has a very good use, but the indications when you are taking during the case is a case history. It comes, do not come immediately. It reflects later on, but whenever when you have made a good thoughts over it. So giving a thought process for the to the after the case taking, analyzing it properly and deep thinking and taking into consideration the past history is essential whenever you are trying to use any of the nosodes of your Metria Medica. Nosodes needs not cover the entire picture, but at least it should not be prescribed without any symptoms. If you have some indications for the nosodes, you can use it. Some means at least 3, 4, 5 symptoms are there, you can use it. You can include as an intercurrent medicine. But when it covers the entire picture, it becomes the curative medicine. So there are the two aspects of the nosodes, curative as well as removing the obstacles, removing the hindrance that is causing the disease. So these are the aspects that I have tried to explain you about the work about the Bacilinums as a homeopathic medicines. And now I say initially people thought that nosodes should not be the homeopathic medicine, but with this understanding of Dr. Chronic disease, you can think that even, it is a deep medicines which is usually which should be usually taken as the anti-miasmatic medicines, anti-miasmatic primary medicines for the removing the miasma from your life. So with these thoughts, I think I may be clear to some extent to you. You can write me to me on my WhatsApp number or the email for any of the query. I'll be happy to respond to you. And with this, I close this session now. Thank you. Thank you.